Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Melissa Huritzik. Sit back for 20 minutes of health news you can use, including a diabetes diagnosis doesn't have to be scary. You'll learn how simple steps and local support can help with this chronic disease. And if you experience frequent heartburn or maybe even a chronic cough, our local expert has information you'll want to learn about. And find out how heart patients are getting important recovery help right here in Lake County. But our first couple of stories highlight a Lake County hospital's efforts to improve patient safety. It may seem like something out of a spy movie. Patients at Florida Hospital Waterman will now offer their hand instead of a picture ID when they register for care.
Our new system is a biometric patient identification system that ensures that when you are registering for services at Florida Hospital Waterman, we are able to identify you and coordinate that with your medical record using biometrics by the way of palm scanning. Your biometrics are unique to you as an individual, where you might share a name or a birth date with someone else, and so it gives your identity much more security than, say, your social security number, your identification card.
And in the interest of patient safety, Florida Hospital Waterman has become one of the most wired hospitals in the nation. The hospital has achieved the prestigious HIMSS Level 7 designation after going through a rigorous process to enhance electronic health records.
HIMSS Level 7 stands for Hospital Information Systems Society. And what it is for HIMSS Level 7 would be the highest adaptation for an EHR that you could have. You no longer rely on paper or charts. You actually go to the record. Everybody uses the same thing, which is going to make the patient safer because all the information that you use is up to date. So if a doctor changes a medication, it's there right now. It's really, patient safety.
To keep up with other innovations, visit fhwaterman.com. Helping heart patients resume their daily activity is an important part of their successful recovery. Post-procedure patients can expect to attend specialized physical therapy as soon as they're able.
Ideologically, we enroll every single patient into cardiac rehab, whether they're a 40-year-old former athlete or they're an 85-year-old grandmother, because clearly something got them to heart surgery that didn't work out so well. And it takes into account patients' post-heart surgery limitations and what are the benchmark goals as far as breathing, weight loss and recovery, physical activity, and it puts them in a monitored environment so we can kind of understand not just what are their abilities, but what are their goals and how do we safely elevate them.
The first day they put me on what they call the new step, which is like a recumbent bike, and I was on there on level 1 for 3 minutes and I didn't think I was going to make it.
Dr. Allen prescribed cardiac rehab sessions for Lindsay Richards after open heart surgery.
And by the time about halfway through, I could do 10 minutes on the highest level and it wasn't anything. So I stopped that one and moved over to the rowing machine, which was, considerably harder. So during my 36 sessions, I made tremendous progress.
As far as what intensity they need and for how long, it's also very individualized. So if we're trying to get someone, say for example, to walk a mile a day, some people get to that very quickly, some people never get to that. But I would say in general, the average amount of outpatient cardiac rehab is anywhere from 4 to 6 weeks.
I have my wife convinced that I can do everything but dishwashing and vacuuming.
You'll find more information about extensive cardiac resources here in Lake County by visiting fhwatermanheart.com. Next, a local specialist wants you to know about a condition that often presents with chest pain, and without treatment, it can lead to serious issues.
Usually people present as heartburn, indigestion, having bitter fluid in the mouth when they go to sleep, wake up in the morning. These are the common symptoms of acid reflux. The unusual symptoms are having chronic cough, having hoarseness of voice, having bronchospasm and wheezing. If you have acid reflux unchecked, it can give rise to stricturing or scarring of the esophagus, and which goes on to patients having difficulty swallowing. They can get ulcers in the esophagus, which can cause chest pain and bleeding.
Dr. Dufare says several lifestyle factors can lead to acid reflux, such as being overweight, eating large processed meals, smoking, and not exercising.
They have very effective drugs. People no longer need surgery, and the drugs are essentially proton pump inhibitors, and people have dramatic change in quality of life on these drugs. Most of the times people need it for the life, but if people stop smoking, lose significant weights, become active, change their eating habits, people go off drugs.
If you or a loved one suspect acid reflux, visit the website on your screen to find a specialist who can help. It's time to take a short break, but we have plenty more ahead when Waterman Wellness continues. Stay tuned to find out about an accessible and relatively inexpensive screening that can help identify lung cancer earlier. Some breast cancer survivors in Lake County now have a special reminder of the cancer team that supported them. And eating burritos can be healthy. Keep watching for an easy recipe for your entire family. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. And you might want to check out these upcoming community events. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Melissa Huritzik. Local physicians are advocating for their peers to use a simple screening to help save more lives. Specialists point to evidence that CAT scans can be effective in identifying lung cancer at earlier stages.
So it's very hard to diagnose lung cancer at early stage. Most of the times, when we find it at early stage, it's incidental. Patients don't have symptoms, but they had other problems. They have a cough, like sniffles, infection. A couple years ago, there was a presentation where they found that screening chest CTs can reduce cancer death by 20% from lung cancer in the high-risk patients.
A CT scan or CAT scan can be done right here in Lake County with a primary doctor's order. Dr. Hussein says the test is inexpensive and covered by some insurance, including Medicare.
For smokers, that's very important because the American College of Radiology supports lung screening, and there's a certain population where we can find cancers. So not just for treatment, but maybe we will be able to find it early enough that someone can actually be cured or prevented from having advanced disease.
I was a smoker for over 40 years. And I had made several trips in and out of Waterman's emergency room, and I was actually diagnosed in there. I'd had pneumonia a few times, and the doctor ordered a CAT scan, came back, lung cancer. It was just lucky for me that they found it when they did. I just had a really great ER doctor that ordered the right test.
Unfortunately, when the patients start having symptoms, most of the time they are at an advanced stage. We need to educate the population about this. We need to educate the public, tell them, there is this way to be screened for lung cancer. And if your doctor doesn't know about it, you ask him about it so he can go and learn about it and see which patient is eligible for it. You can save 1 in 5 patients.
Spreading the word about breast cancer awareness is an ongoing mission. In our next story, some local women now have a special reminder of the community that supports them. Florida Hospital Waterman anticipated that breast cancer patients and survivors would attend their Pink Out event to kick off October Breast Cancer Awareness Month. So the cancer support team was prepared with specially designed gifts for them.
This is a bracelet that was made, and it's very beautiful, and I think it's lovely, and I love flamingos.
Oh, it's a symbol of total healing and support and love from the ladies here at Florida Hospital, Waterman.
It does not have a ribbon on it for breast cancer, but what it does have on it is the insignia for Florida Hospital, and it also has the flamingo on it. This is a way for them to know how much all of this means to us and to help them through this. And it's a way for them to, I think, look at it and remember all the people who were so special in helping them through their care.
While frivolity and fun was the theme of the Pink Out celebration, the hospital takes the mission of preventing breast cancer and caring for patients seriously.
I think for us it's extremely important from a mission perspective to do everything we can from a quality perspective, from a physical perspective, from a mental perspective, from a Christ-like perspective as well, to do everything we can to make folks whole again.
I'm still going under treatments, and I feel like it's such a big encouragement to look forward to instead of feeling like when is it going to be over.
You and your loved ones will find a number of cancer resources available here in Lake County when you visit fhwatermancancer.com. You may be like many in Lake County living with or who recently received a diabetes diagnosis.
Here at Waterman on any given day, about 35% of our patients are diabetic and about 45% are using insulin every day. I feel like the diagnosis of diabetes is devastating to someone. It really changes their outlook on life. Someone who formerly thought that they were really quite healthy, all of a sudden are diagnosed with a chronic disease with lots of long-term side effects.
Fortunately for diabetes patients and their loved ones, there is plenty of help to control the disease.
Here at Waterman, we do a great job with diabetes education. The first and third Wednesday of every month at 5 p.m., we have a diabetes support group. Anyone from the community is welcome. They don't have to have been a patient here. A new program that we started at the beginning of the year is a comprehensive diabetes self-management course. It is 5 weeks long on Mondays from 5 to 7. We spend about 3 hours talking about food. We talk about what diabetes is and what caused it and what you do about it, how to prevent the complications. We talk all about your medications, and we also welcome anybody from the community for that program.
It's helped me tremendously by lowering my insulin, by making me feel better, exercising, and finding out exactly what I'm taking and what it's doing to my body and how it's reacting, which was a big deal for me.
To learn more about the diabetes education resources available here in the community, visit conrycreationhealth.com. So what's on the menu for someone who's adopting a healthier lifestyle? The Florida Hospital Waterman team has a great idea. We join them now in the Conry Creation Health Center kitchen with Jenna Krager.
Are you trying to eat more vegetables? Well, what about subbing them out for meat in one of your favorite recipes? We're joined by Florida Hospital Waterman Executive Chef Jason Boulay and registered dietitian Mara Gallo, and they're going to show us a recipe that is full of fiber and flavor and actually helps control your blood sugar. So Mara, what meatless recipe are we making today?
Today we're making a veggie burrito with black beans as our source of protein. This is great for diabetics because it's very high in fiber. We're using a whole wheat tortilla shell, which has about 6 grams of fiber per serving. And then with all the vegetables and the black beans, this is going to help diabetics' blood sugar from going up too quickly.
All right, so Chef, tell me what we're putting in this burrito today.
Well, today this is going to be kind of really straightforward vegetable burrito. We've got some black beans, some diced carrots, some fresh tomatoes, a little broccoli, and some cauliflower. We're going to add just some nice southwestern spices, a little chili powder, black pepper, some ground cumin, and some garlic powder.
So a couple ingredients that you wouldn't ordinarily think would be in a burrito.
Right. Once we get these all cooked up, we're going to go ahead and we're going to stuff the burritos with some fresh lettuce, some grated cheddar cheese, and some fresh avocados. First step is just getting a little bit of oil going in the pan.
Eating a high high fiber meal full of lots of vegetables is what's really going to help. And vegetables like carrots and cauliflower and broccoli don't have much carbohydrate in them at all, so it's not going to raise a diabetic's blood sugar. The black beans, however, are a good source of carbohydrate, but this is a nice balanced recipe, so you're not going to have too much carbohydrate at one sitting.
Add some of our dry spices.
And the good thing by using a spice combination like this is you're not adding a lot of salt. If you're using a taco blend or something pre-bought from the grocery store, typically there's a lot of sodium in it. So there's no sodium in those ingredients you just added.
Okay, and lastly, we're gonna add our tomatoes. So you really wanna do about a half a cup or so of the vegetable mixture in here. And you just wanna add a little bit of the cheese, a little bit of the shredded lettuce, get them cut, and be ready to taste.
All right, it's almost too pretty to eat. And you don't miss the meat at all. You really don't.
Very good.
Yeah, thank you, Chef.
You're welcome.
If you'd like the veggie burritos recipe, visit watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the December episode right here on Lake Sumter TV for some of the following stories. If your child seems to get sick a lot, you'll want to watch to learn how a local hospital diagnosed a young patient with a disorder that causes frequent fevers. A local expert explains how shared care choices offer peace of mind for patients and their loved ones. And sweet potatoes are a holiday staple. Next month, Chef Jason has a recipe for a melt-in-your-mouth side dish that will look so elegant on your table. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Melissa Hritzik for the award-winning Waterman Wellness.